Good morning, everybody. Your Excellency Mariam Jalahma, the CEO of the Government Hospitals of Bahrain, Dr. Jassim Haji, the Chairman of the Conference and President of the International Group of Artificial Intelligence Community, and all of the organizing team that put together this wonderful conference. Thank you for your invitation to speak to you a few words from my perspective of being a physician and a healthcare provider at the American Mission Hospital here in Bahrain. The second virtual summit on AI in healthcare is itself one of the indications of how quickly we have all adjusted and adapted to what is a future that is well upon us, accelerated by what the COVID did to all of humanity over the last 2 years. Today, we are forced to adapt to technologies that are beyond what we have envisaged or imagined over the last few years ago. I recently read in 2008, fewer than 1 in 10 hospitals had adopted an electronic healthcare records. Today, it is mandatory that any modern healthcare institution has to have an electronic healthcare records, and often patients have access to their own electronic healthcare records through the web. There are lots of reasons why physicians were slow to adapt to having electronic healthcare records, because a lot of physicians of the older time were technology agnostic, and to adapt to a newer technology that interfered with dealing with patients became a big obstacle in how artificial intelligence and electronic healthcare records was initially embraced. However, this all changed with COVID, when we were forced to go on to telehealth as a medium of consulting with patients remotely, when face-to-face contact was just not possible. Today, most of the developed countries have digitized their healthcare records, and patients have access to their own healthcare records. The AI market, as we know of today, was in 2021 around $11 billion worldwide. And by 2030, this is set to exponentially increase to close to $190 billion by 2030. And this is at a compound annual growth rate of close to 37% from 2022 to 2030. Healthcare AI is basically the application of artificial intelligence to augment human intelligence in the provision of medical services and to the safe and efficient deployment of healthcare services to the public. In this domain, multiple modalities come into play when we talk about artificial intelligence. Machine learning, large and often unstructured data sets, how that is analyzed, the use of advanced sensors in monitoring patients both in the hospital settings and at home, natural language processing, NLP, which has become fairly much more routine, the use of robotics, VR and AR, both as augmented realities that will help shape the future of healthcare. While there are many opportunities, there are also indeed great many challenges. Firstly, I would talk about how AI might augment health administration. 25% of the cost of healthcare provision rests in the admin area, and certainly a lot of automation and today's generative AI can save a lot of these costs, which are repetitive costs that can be done by AI rather than deploying humans. The other space where AI is going to have a significant impact is in the use of clinical applications, both in surgery and the use of robotic surgery in advanced surgical procedures. And finally, in the space of training and research. Most surgeons now train on simulation models, which are AI-generated and advanced GI-generated models, where most of the practice is done so that the performance on real patients is actually operationalized to produce the maximum benefit for patients. In this conference today, you will be deep diving into the very many aspects of AI and its applications in healthcare, and I cannot but end this few words by reminding everyone, cybersecurity is a constant threat when we go more and more into the digital space. And so this is particularly important in the healthcare space, where data has to be protected and preserved. So I hope and wish that you would have a wonderful conference in the second virtual summit. Thank you.